Hello guys, this is Brian here with a week 4 post-op panniculectomy update. And it has been 1 month since my panniculectomy. I had it on November the 13th and today is December 13th at 1:30 in the morning. I went to the doctor yesterday and everything looked good. He said I'm healing fine. And some of y'all had some questions about my surgery, so I'm going to hopefully try to answer the best of my knowledge. He did release me to go back to work on Monday. However, he said if I go to mid throughout the day, if I don't feel good well enough to do my job, he said he could let me have another week off. No big deal. Just call him up and let him know. I'm still big time swollen in my thighs, above the groin, in my the incision obviously. And he said most of it will go away. The swelling above my groin will go away within a month or so because this is where the drain tubes were and things like that. I have 3, and the 3rd drain tube came out all by itself last week when we were changing the gauze around it and peeled off the medical tape. The thing was out by itself. The only thing was holding it was the gauze in place. It was amazing. It didn't hurt one bit. For those who don't know about drain tubes, and eventually your body starts to reject them, especially within 3 to 4 weeks of having them in. It's because it's a foreign object, so your body will start to push them out. One did hurt, and that was the one I pulled out myself because it was almost completely out. I think it was like maybe a half of an inch inside, and the edge of the drain tube was causing a lot of pain. I think that my pain was from that. And when your body starts to push them out, you kind of feel weird, like an infection is coming on, or a cold, or you kind of get real weird feeling. So I've been taking antibiotic, and I think I got 1 day left on that, and I don't have to take the rest of the day anymore. He also said no exercising for another 2 to 3 weeks, no lifting or anything like that, no strenuous bending over, anything like that. Of course, if somebody drops on the floor, you can bend, you can bend it up, bend over and pick it up, but don't overdo it. He said I can resume exercising within 2 to 3 weeks. Only thing he wants me to do is just walking. Don't overdo walking, anything like that. I'm still swollen with my thighs big time. Above my groin, I'm swollen there too, where the incision is because of the drain tubes. I'm also swollen more on my right side than my left side on my stomach. He said all this will eventually go away within 6 months to a year. Weird thing is, I have a lap now. Beforehand, I did not have a lap, obviously. Someone had asked me, some of y'all had asked me some questions, so I'm going to answer them. The first question I received is, did he use staples? The answer is no, he did not use any staples of any kind, and thank God for that, because they sting when they remove staples. I had staples with my gallbladder surgery. I think they had 4 incisions total, and I think 1 or 2 were staples, and the rest was glue. And they just kind of sting when they pull them out. And it kind of looks weird, So thankfully, thank God, no staples were involved. And I did ask him about that when I met him the very first time. He said he doesn't use staples at all, for his practice. Very extremely rare cases if he ever does. I think he said maybe once every couple years. Worst case scenario, maybe somebody has been in a horrific car accident when he has to do that kind of reconstructive surgery, maybe then, but no staples. I don't know if that's because he's a plastic surgeon. I don't know if that's his personal preference not to use staples. I don't know, because some surgeons use staples and some don't. So I guess that's their personal preference. My my gastric bypass surgeon did not use any staples either. I have seen some weight loss surgery patients, they did use staples, so I guess it is up to the doctor's preference on that. The next question I received is, did I personally have to change any kind of bandages around my incision? And the answer is no. The doctor did not make me do that, nor let me do that. My paperwork told me that was up for the doctor or the nurse staff to change any kind of bandages. And I have a picture of the bandages, and y'all saw this beforehand. It went from hip to hip, and they were more padded on the sides rather than the front. And they kind of put these on when you're laying down, so when you get up, they kind of tug and pull when you stand up. And sometimes that could be some pain. It could be painful, and I'm thinking some of that my pain came from that. The stick, the way it was put on, because you're laying down, but when you get up, your body shifts back down, and it pulls. And after a while, I guess like a week afterwards, the sticky stuff became itchy on the sides. So this is what my bandages look like. And of course, that's my drain tube, but it went from hip to hip. I don't know if y'all can see that well enough. And I didn't change that. Now, however, the hospital did send a whole bunch of those things home. I don't know why, but my discharge paper said, do not change bandages. Only office staff were allowed to do that. The only bandages that I did change, I had help changing, was the gauze around the drain tubes, because they do leak. That's normal for them to leak and things like that. And actually, I'll show you a trick about that. I don't have an actual pair of gauze in here. I only have them in the other room. So I'm going to pretend this is gauze. It's a piece of paper. If you fold your gauze in half like this, and you cut a notch out like that, and you turn it around, and you snug against your drain tube, and tape the sides, this will catch the leakage and blood that leaks from the drain tube. And that's a pretty good trick. That's what they taught me on my first post-op at the doctor's office. So that did help a lot. The second question is, do I have a before and after picture? I did find a picture where it was stuck in the envelope from Walgreens. I did find a frontal view before surgery, and I'm going to show you the picture. Let's see here. Of course, I'm trying to cover up something else, but that's what I look like before surgery. And that was in the pre-op area before I got my hospital gown. So anything below that belly button's gone. And I'll show you where they drew the line. Can't give you an idea. So that's where the incision was, where they drew that line. So anything below the belly button's gone. So that's, somebody had asked me about that, and he said he took off 13 pounds. And another person, or I guess the same person, can't remember, had asked me, how did I hear about this doctor? Well, the truth is, I heard about him 2 different ways, coincidental, basically. The first time I heard about him was Connie's videos. When she had her reconstructive surgery, she mentioned his name. And you need to follow her journey. She's Rosemary's sister, which her channel is QuiltingConnieB. Her name is Connie. And she had her arms done. I think she also had a panniculectomy. I can't remember exactly, but I think she did. Excuse me. And when she mentioned his name on her video, because I asked her not too long ago about that as well to confirm. And when I heard about that name for the second time, I looked at my gastric bypass binder, because I saw, I recognized that name from somewhere. I looked up in my binder, and it's the same group of doctors that my gastric bypass surgeon recommended, which they're in the practice called Dallas Plastic Surgery Institute. And his name is Dr. Sam Jejurikar, Jejurkar. And here's his business card. I'll post his contact information below. if it would zoom in here, because it's a little small print. Well, let's see here. There we go. You want to pause out and look at it. Well, how about with zooming in? If you want to pause that, his address is 9101 North Central Expressway, Suite 600, which is their own floor, Dallas, Texas 75231, and telephone number 214-827-2814. And he's in a group of like 8 to 10 doctors. You kind of go in, and at the signing desk, there's 2 or 3 people that's at the signing desk, because, you know, they run the whole entire office, because there's a spa across the hall and day surgery and all that. And then they, you know, you sign in, then you go to the little waiting room. And then the doctor's medical assistant, because there's different ones in there, calls, you go back in there, and their little sub area. It looks like, to me, each doctor has their own little sub area. Like own little receptionist area and their own little examining rooms and all that. And his receptionist has been very nice. She got my disability paperwork filled out correctly and didn't charge me. And my disability, which is through Aflac short-term disability, they did approve my disability for that for a month, minus a 7-day elimination period. So they did pay. Now, of course, it's not my full pay, but something, you know, better than something than nothing, I guess. His medical assistant and nurses has been very great. I liked him very much because he did respect my privacy. Now, when you go for a consult, you're going to have to strip down to your underwear and let them, you know, he has to touch you, you know, examine you, feel, make sure you don't have any hernias or anything like that in the area, and you know, do a physical examination for the medical record. Just make sure the insurance company does pay for that as well. Now, at the hospital, which I have at Dallas Presbyterian Hospital, Dallas, I was in the pre-op area right before you go into surgery. They had at that hospital they had 2 different pre-op areas. One is you go up to the 2nd floor, and it's like a regular hospital room with 2 beds, and they get you laying down. And, you know, you strip off, you get your hospital gown on, and then they take your blood pressure, they get your IV started. They can get a vein in there. It's like a holding area almost. And then they come get you and take you back down to the operating room floor, which is like the lower level below the 1st floor. And then they put you in a different pre-op area, and then it's like a big giant room with different curtains, and that's where the anesthesiologist will come talk to you. That's where the doctor comes to talk to you, the nurse. And they had to have a anesthesiologist start my IV because they couldn't find a vein and things like that. Then he came in the little air, you know, curtains and all that, and he came in the area. And I had my hospital gown on, and I already had my pants off and underwear on because, you know, of course, it's surgery. They make you do that. He said, and I had my family member. I had 2 family members there, and he asked them to politely get up and leave because he has to do the markings. And my grandma was there, and she didn't catch that. And I just blurted out real loud because they gave me something to make me goofy. And so he's going to have to put markings on my stomach where he's going to cut it off. And she's, oh, and she finally caught it. And he was there. He also had the operating room nurse there. Now the nurse kind of stood on. I can't remember if she stood on the back of me or on the side of me. She didn't see me frontal view like he did. So he made me lift up my hospital gown, you know, all the way up to my neck and chest, and I was completely naked, you know. And he drew his lines where he was going to do the incision and talk to me and what to expect after surgery. Now, he told me I was not going to wake up with a pain pump, but I guess I did wake up in some pain, and they did put me on one, so, you know, I guess that's determined after the surgery. And the operating room nurse was asking him before we went to the operating room, they have all these questions to ask the doctor. Did he want me to have a Foley catheter? And I popped in and said before the doctor answered, I said, no, I don't want one. And he said, no then. So that's how that went. Pretty much okay. Of course, you're going to have some pain, but nothing like gallbladder surgery when they blow up your stomach. Getting back to the doctor's office, there is a lady that was in there every single time I went. And she was kind of hitting on me. And she said, well, you look so good. And all this, because she saw... I didn't see her before my surgery, but she told me, we were talking. She said, I remember you. You came in here a month ago, and I noticed that you had your stomach surgery done because she knows a difference. I said, yes, I'm a weight loss surgery patient, and I lost over 100 some odd pounds, and next the skin got really aggravated and affected, and he finally removed it, and we were talking together. And she was in there because she's a cancer patient, and she was having she had a mastectomy done, and she was having reconstructive surgery on her breast, and we were we always talk we were talking like yesterday, and I said, I see you in here all the time too. So, you think of plastic surgery and all he does plastic surgery, and that's not always the truth. They always do they also do reconstructive surgery, on people. There was a guy in there that had a really bad accident with his leg, and he was in a wheelchair, and he was getting skin grafts done as well. So, it's not always people in there getting nose jobs and facelifts done. Although there's some people in there I saw. There was one lady that looked like she did have a facelift, and her face was swollen big time, like she got beaten up with a baseball bat. So that looks painful. Ugh. With your face. But that's how that went. Someone had asked me, what did this cost my insurance company? I didn't have to pay anything out of pocket except when I was referred to the internist doctor for medical clearance for the pre-op testing. I paid $25 copay for that. And that included the x-ray, the EKG, the blood work, urine test, head-to-toe examination to make sure I was fit for surgery and was cleared for surgery. And that was $25 out of my pocket. The rest of it, I didn't have to pay a penny. I think the grand total, because I looked on Blue Cross's website, came out to $55,000, which included the doctor, this anesthesiologist, the hospital. The hospital alone was $45,000, and of course that included the lab. Any labs, of course, you either draw the blood when you're in the hospital, and any other things they had, breathing exercises they do, which I think that's included on the hospital bill. I think the grand total on Blue Cross paid, because I didn't pay anything else because I met my co-insurance deductible. I think after that, I think they pay like $23,000 or $24,000 for everything. So really, my out-of-pocket expense was just $25 for the office visit for the pre-op. Somebody asked me why I didn't go to Forest Park Medical Center. I think I did explain this. Forest Park Medical Center, Frisco, where I wanted to have my surgery, was out of network. They did not contract with Blue Cross. And I mentioned that to the nurse at my doctor's office. I said, that's kind of strange. For those of you who don't know, Blue Cross Blue Shield is one of the largest insurance companies here in Texas. So it's very rare that a hospital does not take them. I mean, very rare. I have really never came across that, or actually. And the nurse also popped up and said, yeah, it is rare because they also don't accept Aetna or United, which is also the largest insurance company. So you have Blue Cross, Aetna, United, and Cigna here in Texas. And then you have some off-brands that use different PPO networks. But usually, those are the big major players, and you don't accept those. You are losing money out of your ass big time. So I'm not going to pay additional money for out-of-network benefits. I already met my network. Very rare. I have never really went out of network for anything, basically. Now, in the emergency room situations, my insurance company, by law, has to pay in-network benefits, but they can balance bill you. They don't have, they can balance what the insurance company doesn't pay if it's at a network provider. So they had to pay you at the same level. But other than that, I never gone out of network for anything. And I always heard those always bad experiences with that. So I kind of mentioned that to him. I also mentioned that to that doctor as well. I said, I wanted to have it done. Well, you want me to have it done to begin with, but they don't accept Blue Cross, and I'm only going to go with my insurance is accepted. I'm not going to pay anything out of pocket. He said, yeah, that is kind of weird, but however, it is a new hospital, so it takes a long time for the hospital to be accepted into the PPO network. And believe it or not, that's what my aunt does at Blue Cross Blue Shield. She's in the hospital and in provider contracting department, and it is a long process for a hospital or a doctor to be accepted in the insurance company. And I want to tell you something about that, and my aunt told me this. If you go to a doctor and they don't accept any kind of major insurance, like United, Cigna, Aetna, Blue Cross, or whatever you have in your state, and they don't accept any of that, there's usually a problem in his background. Either that he's in trouble by the state, or that doctor's license is fixing to be suspended, or bad malpractice, or sometimes doctors can't write prescriptions for narcotics or schedule narcotics or controlled substances, is because of that reason as well. If you ever go to a doctor and you have a broken leg and they won't give you any kind of pain medicine, it's because they've been in trouble for prescription problems, and then things like that. So it's always something that you want to look out for. So if they don't accept any kind of major insurance, there's something going fishy about that. But usually a facility that doesn't do that, usually it takes a long time for them to be accepted into the PPO network, because there's so much paperwork. I think my aunt said there was like 300 pages of applications that they have to fill out, and they have to check with the state licensing board and all that. It just takes a long time for them to do that. Other than that, I'm doing okay. I don't have to see him for another 3 weeks. Without my binder, he did say I can take my binder off at night time, but I do have to wear it during the daytime for another month. The strange thing is, since they removed 13 pounds, I have to get a smaller pant size, which I did. Without my binder, I can wear a size large. With my binder on, because it's kind of thick, I have to do it extra large. I think without my binder on, I think I can fit in a 2X. So hopefully in a month, I already got some extra large, large size pants, because I noticed without my binder on, my extra large pants fall down to the ground almost. So if you have any questions, comments, please let me know, and I'll be happy to answer. You can private message me or just post them below and I can reply. I have to start watching some y'all's YouTube videos. I've kind of been liking on that, kind of been focused in another area. Try and get covered. I'm going to be changing my insurance beginning of the first of the year, and I'm going to tell y'all, I'm going to do a video about that, about Obamacare, what experience I had with that. So stay tuned. I'll probably be posting that pretty soon. So I will talk to y'all later. Oh, also, I forgot to mention, y'all need to follow Belinda Ball. I think her last name is Ball. Belinda Ball's video. She also had a panniculectomy done around Thanksgiving as well. So check her out as well. I will talk to y'all later.